Our first panel of the day, employee engagement, how to keep your behavioral health staff motivated and providing quality care, is beginning now, featuring Jordan Young, Dr. Marlon Rollins, and J.D. Kalmenson.
All right. Good morning. Come on now. Yeah. Hey, thank you guys for coming in. I'm Jordan Young. Glad to be a part of this panel with JD and Marlon. Let me start off by reading their bios. Dr. Marlon Rollins is a member of the California Hospital Association and a licensed therapist with more than 15 years of experience in mental health, dual diagnosis, and addiction treatment management. He served as CEO and COO at some of the largest psychiatric hospitals and addiction programs in the state of California. In his role as COO and President of Addiction Services with Renewal Health Group, Dr. Rollins supports leadership to align operations to meet organization goals. He also advises on strategic planning with the CEO and CFO to help enhance program services.
Thank you, Jordan. All right. Good morning, everyone, and thank you for joining us. Really happy to be here. Really have enjoyed the time in BHASe, and really happy to be able to share some insights about our work with Renewal. And thank you, Jordan, for the introduction. Again, a little bit about me. I've been in California for a good 6-7 years now, and originally from Indiana. My doctorate is in psychology. Again, I'm a licensed therapist. And I've worked with some of the larger hospitals here, UHS. I've been a CEO and COO of Acadia Healthcare, and also AAC. And about a year ago, I joined with Renewal Health Group based out in LA, which our CEO and founder is here to kind of talk more about the programs. But again, just an extraordinary program, and we're really excited to be able to share what we've done with the culture, what the founders have done, and how that has positioned us for a lot of growth and quality outcomes in the area. So thank you again for joining us. Thank you, Jordan.
And J.D. Kalmenson, he's the CEO and founder of Renewal Health Group, a family of addiction treatment centers, and Moderator Behavioral Health, a comprehensive brand of mental health treatment facilities in Southern California. J.D. is a Yale scholar, a skilled facilitator, teacher, counselor, and speaker who has provided chaplain services to prisons, local groups, and remote villages throughout the world. His diverse experience as a rabbi, chaplain, and CEO has inspired his passion and deep understanding of the necessity for effective mental health treatment and long-term sobriety.
Thank you, Jordan. Good morning. Thank you all for joining. I know it's one of the earlier ones. Glad to be here. Beautiful conference. And just to share a little bit about what brought me here, I think it was after doing some chaplain work at 40 correctional facilities and seeing firsthand that so many of the disorders and human ills and a lot of the undesirable aspects of society could have been prevented with a lot of effective care in a compassionate and competent setting. We set out in 2016 to open a network of addiction treatment centers. That was 2016, which would strive to combine some of the clinical sophistication you would find in the bigger outfits with the boutique quality of empathy and authenticity and purpose, which are our core cultural values. Fast forward in 2019, we opened up the primary mental health division, Moderator Behavioral Health, and now we just dipped into the eating disorder population, but really all revolving around those same ethos and values of empathy, authenticity, and purpose, and trying to combine what you might find in some of the larger outfits as far as the professionalism, but as well not losing that unique signature character that behavioral health really mandates, which is the feeling of comfort and safety that a client walks in through those doors. So glad to be here, and thank you, Jordan, for moderating. And we have our rock star, Dr. Marlon, right here at the side, so I'm super excited.
Yeah. And I'm Jordan Young. I'm CEO of Jordan & Associates Consulting. I have worked in behavioral health care for 13 years. The primary focus of my consulting business is helping treatment centers hire key staff. So frequently when I speak with individuals in the field, they're usually unhappy with their current position. And one of the things that excited me about this presentation is something that I found out from you guys about your low AMA rates. And anyone that works in the field knows that low turnover or low AMA rates is typically the result of happy workers, satisfied clinicians. So can you guys share some data on the low rates that you guys have had of AMA across your various facilities and different locations?
Sure. Absolutely, I'll speak to that. And again, I think we want to emphasize here is that the only way that you get good quality outcomes is if you have an engaged workforce. And again, when I joined with Renewal Health Group, and JD and Elliot, who is the CFO and founder, we had this discussion about how do we focus on retaining our clients better within the program. So we wanted to make it a mission and a focus so that we would have better outcomes. If you don't know what an AMA is, that means against medical advice or against clinical. So it becomes a safety issue as well if somebody leaves your program early because clients are there voluntarily. So we've set out an initiative and made it a focus for the programs and the leadership there, and we had a program go 89 days without a client leaving the program. So it was a really incredible feat to be able to execute. I have not seen that. I've seen AMA rates that range anywhere between 20%, and you're constantly churning. And again, it brings a big safety risk. It's a taxing on the healthcare system that you're a part of. So for us to be able to deliver on that was just incredible. So it really boiled down to the culture, and I'm hoping that JD will give you some more insights about that. And we wanted to make that as, if you want to have quality outcomes and focus on certain KPIs within your organization, how do you execute on that and making sure the workforce is aligned with it? Because sitting up here on the stage or in an administrative office somewhere, that's not going to happen.
Absolutely, and I do want to say that 89 days was largely the result of an effort and an initiative that Marlon was really instrumental in spearheading. The gist of it, I think psychologically, is that we were trying to create ownership across the entire facility. So typically, if there is a disturbing number of AMAs, it's going to be one person who has to account for it or to explain or rationalize it. So we established a incentive program where the entire facility would be rewarded a portion of their salary for everybody chipping in, because as we all know, if whoever is operators in the room, AMA blocking it takes a village. It's a group effort. It's not necessarily one position or one role that can prevent the AMAs from happening. And what happened is there was a sense of ownership. Think about it for a second. You never treat a hotel room the way you treat your home. And you could treat a hotel room really nice and fine, but it's not going to be the way you treat your home because it doesn't have ownership. And so when all of the staff, from the residential aides and the techs to the nurses to the clinicians to the director, all were unified with this collective mindset that together we're on the same boat and we have to step forward and we all have ownership and investment and equity in making sure that the AMAs are not happening, there was something extraordinary. All of a sudden, call-outs started to drop. Call-outs as in the shift call-outs. And the shift call-outs really create a deterioration in morale, because if one person calls out and then somebody else is going to have to fill in, and they're understaffed and a lack of consistent, excited staff creates an environment for the client that is not necessarily safe. The protocols are not necessarily being adhered to on a consistent basis. And so everything that you plan for doesn't necessarily get executed when you have a breakdown in the vision and the execution. So really allowing them to come forward with a sense of ownership created a feeling amongst everybody, we're in this together, and that was able to bring forth a sense of consistency, a sense of excitement, which resulted in that extraordinary statistic that Marlon referenced.
Great, that's excellent. So you guys have talked about in prior conversations with me about how you guys assess the company culture and how that was so important for you. So can you talk a little bit about how you did that, and also while you were doing that, how you were able to create a safe place for employees to provide their feedback without fear of retaliation?
That's a great question, and because you have to create safe places, and I'll let JD talk about the second half of that question. I'll take the kind of the front end of it on the assessment side of it. So just like with you're trying to found any kind of program, you want to do due diligence. And my objective was to come in and do due diligence on also the culture of the organization. And that means good data. Again, as a clinician, I kind of look at organizations as come in and do an assessment so you know exactly what you need to do. If we have an objective to accomplish, what do we need in place to be able to do that? Where are our pain points, if you will? So coming in, we spent the first good 30, 60 days doing an assessment on the workforce. So this means doing surveys, recognizing that culture is key. And if you were in sessions yesterday, you heard about how important that is to have a good work culture, which sounds like something that's really undefined. And you really have to get good in leadership to defining exactly what it is your culture is all about. And you can measure it. So we did an employee engagement survey and asked our employees how they felt about the workplace culture. And we got some incredible outcomes that I had not seen in working with other organizations. A lot of times I'm coming in and there's a lot of cultural cleanup. If you've ever dealt with a lot of bad behavior, a lot of problems in a company, you have to change the culture. And that's a really difficult thing to do. So we assess specifically, what's the workplace culture like? Are you satisfied with it? We found out that 85% of the employees reported that they were either very satisfied or satisfied with the work culture. We asked them about what was the relationship like with your supervisor. And they told us that either they strongly agreed that they have a great relationship at 85% or agreed with that statement. So again, finding out that they had good connections with their supervisors, which is the main reason people have turnover, knowing that they liked the workplace, they felt supported, they felt heard at 85% or but, I said, we're well positioned to be able to execute. Because if we've got problems with the workforce feeling under-supported, not heard, we're not going to be able to move the organization to get some key outcomes. So that was the first assessment that said, are we positioned or are we not, or do we need to do more work around culture? And we begin to really define the culture itself. And JD, I'll let you kind of pitch over to you about the values and kind of the foundation of that.
So the data is really important because if you can't maintain something that you can't measure, so you have to be able to measure it. I would say that in general, everybody here at this conference and everybody here in this room, we do have a certain advantage when it comes to employee engagement over other verticals and other even areas of healthcare. I think COVID really brought to the forefront the idea of people being passionate about their work. Nobody's looking just for a simple 9-to-5 check. The relationship that your average employee has with their place of work became less transactional. In general, there's sort of three things that you look for in your chances of maximizing your career. You've got your talent, of course, you've got passion, and then you've got your circumstances. I think that passion has started to rise very quickly above the other two. And the reason I say that in behavioral health we're fortunate is because to begin with, even before COVID, I think the folks that work in behavioral health were inspired to choose that profession, not because it necessarily will yield them the most financial return, or not necessarily because it's the easiest, but because they're very passionate, either because they have their own experience or something ignited a spark within them to give back and to find emotional satiation and fulfillment through this field. So we're looking at a demographic that the very fact that they're in our space and they're applying for a job means that they're passionate, most of the time obviously, means that they're passionate about the work. The key is, how do you maintain this passion? Everybody has good days and everybody has bad days, and that's where culture comes in. Culture is, the way I sort of see culture is this unified passion that allows us to all feel this common goal and vision, and it creates a certain energy, a certain ambiance. And it's not something that happens and then you just forget about it. It requires constant maintenance. They say a story about the couples getting a divorce, and the judge asks the husband why, and the wife chimes in and she says, because he never says I love you. And the judge looks at him and he says, is that true? You're married 37 years, you never said I love you? He says, it's not exactly true. 37 years ago we got married and I told her I love you, and if anything changes, I'll let you know. That does, right? So that doesn't work in relationships, and it also doesn't work for culture in the workforce. It's a constant series of initiatives that you have to be taking to keep your finger on the pulse and to ensure that that passion doesn't just remain an ideal that's on the wall or a value that we pay lip service to, but is implemented on the ground. Just to conclude with one more point on this, I would say that when the staff are feeling heard, are feeling appreciated, that puts them in the driver's seat. It doesn't make a difference what position and what role they might be in. And I want you to think about this for a second. How many of you get nauseous in the car? You could raise your hands. How many of you get nauseous in the car while you're driving the car? I don't think anyone raised their hand, because most of us don't. It's not that the road is less bumpy when we're driving the car, it's that we're driving the car, and so the bumps that would normally make us finicky and uncomfortable don't, because we're in the driver's seat. And you obviously can't have every single employee be in the driver's seat, but checking in with them, and I'm not just talking about a quarterly town hall, but having somebody on your leadership team ritualize a group huddle where their input is appreciated, is valued, is cherished, doesn't necessarily mean that all of it has to be listened to, allows them to feel like they're in the driver's seat. And when you do invariably encounter those hiccups and bumps in the road, they don't get nauseous and run to the hills. So that's just a little bit of some observations on the work culture that we experience.
That's excellent, excellent. So when conducting a survey like you guys did on your company culture and company or employee engagement, what should the leaders within an organization do once they receive that data?
It's a good question. So again, the first thing is you want to evaluate it, make sure your hiring managers, your leadership team has the information so that you can have discussions, like honest discussions about what's going well, and find out what are your pain points, where you want to really improve. And you want to do it frequently. I've worked with other organizations, and they'll do an employee engagement survey maybe one time a year, right? And if I'm operating as a CEO and I'm trying to run a facility, I only have one time a year that I'm getting employee feedback in a more formalized way, I really can't make good decisions. Now, if I get it too often, I don't know if whatever the initiative I'm rolling out has been effective enough. So at least we're going to do this twice a year, that we do an employee engagement survey. And in between, we're rounding in employees, we're sitting down with them, and we're also talking with our patients, because guess what? The patients will tell you how your employees are doing. So you sit down, you have an honest conversation about what the results are, and then you communicate it out. So we hold town halls and tell them, this is the voice of what you're telling us. And we take everybody's name away, because when you first start doing these initiatives, people get concerned that there's going to be kind of retaliation. So you don't do that. You make sure that they can do it just completely autonomously, and then be able to share those results and have a dialogue with them, and then talk about what we're going to do, take action on these things, and what we can and what we're not going to do, and maybe when and why. So you get really transparent. So when we talk about culture, culture is a set of behaviors. It's what you do. So it was named yesterday, you want to talk about what are your values within your organization. And the values within Renewal Health Group are empathy, authenticity, and purpose. And we sat down and we defined what those values were by behaviors. Everything that we experience is a set of behaviors. Even within your family, you have certain values. Like if you value family, we're going to sit down at the dining room table and we're going to turn our cell phone out, because that's what we do within our family. That's our culture. Culture is in how we talk to each other. Culture is in how we dress. It's the way that we greet each other. And we really broke that down to make sure we were clear in defining what the behaviors that went along with the organization itself. That way, when we're hiring our employees, we're hiring, are they going to add value? Do they align with that? And I know a lot of employees don't like the idea of saying, we're all a family. They got a little tired of it. After 2020, people are like, oh yeah, whatever. Get over the idea of family. And some people have a family, it's a trigger word, because some of us don't come from the greatest of families. And then I had to ask this question, well, what makes a family functional versus dysfunction? Well, what makes a family functional at any level is if we're aligned in our values, right? Even if within your own home, when you are aligned with your children, your wife, your spouse, your partner, you have a functional family. But when the values are not well matched, you're valuing different things, it feels very dysfunctional. So it's really important as you're building an organization and a work culture that the values are aligned so it's a functional family and people feel safe and can communicate openly within that work system. And that's really what we have to strive to do on a daily basis within the organization, but assessing it in a very strategic way and making sure we're honest and true to the values that we uphold as leaders. And we allow the employees to hold us accountable to those goals.
Beautiful.
So my organization conducted a survey in behavioral health on satisfaction within workers in behavioral health care. And the 5 biggest drivers of satisfaction within an organization or position were compensation, advancement opportunities, day-to-day responsibilities, company mission, and company culture. So in light of finite resources and the ability to make changes in all those areas at once, can you guys talk about some strategies that you utilize within your human resources department to engage your workforce?
I'll just jump in with one of the things that really stood out to us. I think that the idea of incentivizing or trying to motivate somebody through an external device is a little tricky because it's almost like buying somebody a present. A present has to have 2 components in a sense. It has to be thoughtful, and it also has to fill a void that they currently don't have. So even if it's thoughtful, but the individual has what you're buying them, it's not going to be as appreciated. And similarly, even if it's something they don't have, but it's not customized to them and it's not necessarily something that's contributing to their individuality or something that they feel excited about on a personal level, again, the presence efficacy is minimized. One of the things that really went a very far way was our initiative of helping them with their professional development through covering their tuition in advanced certifications and other clinical initiatives that they were embarking on. And that had to do ranging from those in our therapists who wanted to become certified in somatic experience and hypnotherapy, whatever professional degree or tuition component they were seeking. And obviously it's not a blanket sort of opportunity, but within the growth of their current status or their current job description, we said, we're investing in you. And it really filled both of those components. Number one, it's something that they chose. They obviously were passionate and interested in pursuing that advancement in their professional career. And number two, in many of the cases, it was something that on their own they would not be able to either afford or dedicate resources to. So it was very meaningful to them. And also the very idea, the statement that we are investing in you was a very powerful message. And the response was really overwhelmingly positive. I mean, contrast that with, let's say, some of the other initiatives that we took, which weren't as effective, like covering people's fitness club, their gym membership. And that fell in one of 2 categories. Either those who didn't go to the gym before we made the offer and they weren't going to the gym just because we were offering to pay their gym membership, or they're very passionate gym enthusiasts and this is something that they were doing regardless. So it didn't have that same efficacy. So that's just one of the things that, from everything that stood out, that was the most interesting and intriguing to me. But I'll pass it on to Marlon.
It really is important that you find your employees' love language and to understand what makes them feel cared for in the workplace, not based on what we think, but based on what their needs are, because you don't know what their needs are specifically. So one of the things that we learned within the organization in doing the assessment is that there was a training need in the professional development. There's none of us in this room, I would imagine, that have not been supported in some way professionally in our career, and that was something that we desired. And if we had an employer that was willing to support our development, then we were drawn to them because we had opportunity for advancement. And if we didn't feel like we're getting opportunity for advancement, guess what? We leave to go find a place and where we can feel supported and we can develop. So the employees said, we want training. So the initiative, what we did with the first quarter is like every month we had an intensive training. And we had to think about what's the priority of the organization. Is the training and the well-being of our employees the most important thing? Because we know that there's a cost for training. We have to take people off the schedule. We have to pay them for the training, et cetera. But they appreciated the fact that we were investing time to make sure they knew how to do the job well, because the clients that were showing up were much more complicated than before. So if we're taking, clients who have a little bit more aggression and they've never had that training of like how to de-escalate clients, guess what? We need to bring expert trainers in to make sure you're well equipped to do it. Well, that was part of the AMA reduction initiative, is because we trained them on how to de-escalate clients so they didn't feel scared of them and said, get this person out of here or come into a power struggle. So then we trained them on complex sexual trauma, because our clinicians were seeing that within the clients that were coming into us. We trained our clinicians on psychodynamic engagement with clients. We trained them on how to build and communicate with each other. So we took an initiative every month, and then we post out to say, well, what else do you want training in, right? Then they wanted day-to-day training on specifically how to do their job. I remember I was working with another organization that first started with rounding with employees. It was important, and one of the employees came to me and she says, I'm making $16 an hour. I've got very little training, and Burger King down the street is paying $17.50 an hour. And I don't have to worry about somebody's life and death at Burger King. What are you going to do about it? Now, I could pay her more. I could pay her, which we did increase the salaries at that particular institution, because I was like, well, this is interesting. I'm competing with Burger King. And I said, and we're a healthcare provider. But we also provided training because, listen, it is life or death, and we have to make sure that our employees feel well equipped to help people to know how to do their jobs. So that's really the listening and execution, and they felt like, okay, well, what's the next thing? So like we get excited about the next thing that employees are going to tell us that they really need. We looked at the benefits package. So recognizing it's not just about the salary, that we need to make sure that we're clear in conveying also that we're not only giving you a good and fair competitive wage, but we're also going to invest in your insurance plan and a 401k for you. And we learned also that when it came to our turnover, employees who enrolled in the 401k plan were more likely to stay with the company. And then we also learned that not everybody understood the 401k plan. So then we had our HRD actually start an initiative where they were giving monthly talks on the EAP services, the wellness program, and the 401k. And they were like, oh, I had no idea that I was getting all of that. So they were not so quick to jump to another company who paid them $1 more, because they realized they were getting all of this. They were getting training. They were getting an investment in themselves for professional development. So guess what? We become the employer of choice because employees see that they have an opportunity of a place where they can learn and grow, and the company has a good reputation, right? Everybody likes to work for Google, right? Everybody wants to work for that company that has the reputation that's good. You don't want to work for a company that has a bad reputation, right? So our image is for our employees is just as important for the clients that are seeking treatment. So when leadership begins to understand that, then you can stand out as the employer of choice and then begin to do things and evaluate to show that you have love, care, and support, so you build a safe place for your family. And you always have to be able to show up and manage culture. That's mostly what leadership is. It's not about your KPIs. It's about managing culture. And it is listening, assessing, action over and over again until you're building something. It's about empowering employees. That's how you execute on AMA reduction. I have not ever seen that. And I've dealt with programs that have had 20%. We brought it down to 7%. I was like, oh, this is dope. This is fantastic. To go that long without a client leaving the program, it's just unheard of. So very proud of the team to be able to do that. And now we get excited about it. Let's see how many days can we go. Let's see if we can go past 90. Like, they get pumped up about it, right? And it's fun and exciting, right? And the clients see that and they appreciate that people are working so hard. And then there's data that goes into the AMA specifically, because we identified obviously who's high risk and we put all that together, but we engage the employees to help and they feel empowered to be able to execute on something like that. So that's really how you take an important initiative, but recognizing that the work culture is key to drive those results to get better outcomes.
I just want to add one more point on that, Marlon. What Marlon brought up about the trainings, so just to piggyback off what I started with, so many of the entry-level employees, whether it's behavioral health techs, residential aides, mental health workers, they see their job very much as a checklist of tasks. And it's not. It's so much more complex and sophisticated. Thomas Friedman once said that the difference between a human being and a machine is that when you press pause on a machine, it stops. When you press pause on a human being, it starts. I think that when you sit all staff, including the entry level, and you allow them to pause and you explain to them that there's a method, there's a methodology behind being a successful mental health worker, a successful behavioral health tech, they actually start to see their job as something that has a certain degree of finesse and sophistication, that through these trainings they begin to appreciate what they do because they see that there are certain patterns, there's certain protocols that will allow them to be optimized mental health workers and behavioral health techs, and there's a certain sense of professional satisfaction versus just coming in and looking at it like I just have a list of chores to do. It's much more than that. It's engaging with the clients, AMA blocking, being there to support them, knowing when to pull back. So the training also really gives them a very strong degree of professional satisfaction on that front.
That's excellent.
Yeah.
Excellent.
Good point.
So you talked about the initiatives to move forward with based upon the feedback from your employees. Obviously, you're not going to be able to do that for all the things that they wanted changed. So how did you guys decide which ones you were not going to move forward with? And then how were you able to communicate that effectively to your employees to let them know that even though we're not going to do this, you were still heard?
Yeah. It really was kind of a combination of the kind of the next phase of like, what did we want to improve upon on patient outcomes, right? So, or what was the other priority that we needed to strengthen within the organization, because we're made up of several different facets within the organization. So we told them exactly why we were going to do this investment in their training, because it was the loudest thing. It was tied directly to them feeling safe. Like for instance, compensation came up, but when we assessed compensation, as far as satisfaction was concerned, there was about 30%, 33 and a third were about, neutral. They were satisfied, and 30 and a third were not, and the other third were very satisfied. So it's like, well, it's not polarizing enough to say that we need to really, really focus on this. But it was pretty clear that training was a big, loud issue. So we said, hey, we hear these other issues, and we're going to come back to this, but we've got to make this a priority. And it was just a matter of telling everybody and then explaining, we're not going to do this right now, either because of budgeting, we wanted to build more, or whatever the case was, but we heard our employees in that space at the same time. So it's just a matter of communicating. It's like, hey, we can't do everything, but we're going to do this because everybody's saying this is important. So this is a democracy, so we're going to go with that voice, if you will. That's really how we made the decision, but we made sure that we still kept record of that, and that's why you reassess. And I don't want to wait another year to go back in. We say, hey, we did all this training. Was it effective? Did we see that number go down? And if it didn't, I'm going to go back and say, so we did training. What else do you need?
I would just echo that by illustrating with a story. They say a woman once called Dr. Viktor Frankl in the middle of the night, the renowned psychiatrist, and she was calmly communicating that she was about to end her life. And Dr. Frankl proceeded to articulate reason after reason why she should not go forward with her plan and she should stay alive. After several hours, she says, Dr. Frankl, you can go to sleep. I won't do it. Sometime later, they meet in person, and Viktor Frankl's very curious which of his many reasons was the effective one. What did it? What was the persuasive, definitive reason? And he asked her, and she said, none of them. He says, what do you mean none of them? So why did you abort your plan? She said, the very idea that another human being, a prominent doctor who doesn't know me, would wake up in the middle of the night and not go back to sleep until he had talked me off the ledge, that's a world worth living in. It's a very beautiful story, and it's a very specific story, but I think if you extrapolate one of the lessons of that story, when you sort of listen to your staff, it's not necessarily which initiative did you implement, it's the very idea that you are listening, that you are engaged, and you are taking steps to take their feedback and to put it into motion and to put it into practice. It doesn't mean everything will be able to be operationalized, and it doesn't mean it's going to happen the next day, but that level of engagement is really what's inspiring and keeps them feeling like they're being heard and listened to, and that this environment is safe and is one in which they can grow and feel comfortable in.
Excellent, excellent. Well, we talked about how you guys engage your current staff. Do you have any strategies for new staff that you bring on board in terms of interviewing, onboarding, screening candidates to ensure that they are the right fit for your culture or for the culture that you want out of your organization?
Yeah, no, that's a great question too. I think, again, one of the things that we did is that we have everybody sign a standards of behavior document, which basically outlines the values and the behaviors that you're basically signing up for. Like if you join this organization, you agree to these things. And we try to celebrate the employees when they come in too, to make sure we know what their birthdays are, make them feel special and part of the team. We're rounding on them, we're checking in on them. Again, it's that kind of, we're celebrating this new employee coming into, and I'm going to greet you. We do get a lot of appreciation just to make sure that we have a good fit on the front end. And yeah, that's how we welcome them in. Even before they arrive, you got to think about a client that's coming into the program. Before they show up, they're already getting a sense, is this a relationship that I want to join into? So you want to do a lot of stuff on the front end to make them feel special, find out what their favorite foods are, colors, all that kind of stuff. Send them a thank you letter before they arrive so they feel like, wow, this place is really special, right? And because it's a first impression. Right? So those are the things that we want to do early on when it comes to recruiting and retaining our employees on the front end.
I would just add to that you know, when you're sitting in front of an employee or you're sitting in front of an interviewee, an applicant, and most of you have been in that position, you're sitting in that chair, you really have two directions in what you could direct your line of questioning towards. It could either be experiential. What's your experience like? What's your technical skill set? Tell me how many years you've been on the job. Tell me what your job description was, what the environment of care was, what the line of service was. And you can obviously hear what you want to hear and feel satisfied and go forward with making an offer letter. Or you could spend the entire conversation, or the overwhelming majority of the conversation, trying to get a sense of who they are as human beings, as individuals, what their values are, asking engaging and thoughtful, stimulating questions to get a better sense of what makes them tick, what inspires them, what motivates them. What are they passionate about? We're not prophets, and we will never, you know, get 20 out of 20. But that latter form of questioning, we have seen, does yield a significant higher retention rate because the technical skill set can be trained.
Yeah.
But values cannot be injected or artificially imposed. So taking that approach at the interview level and at that stage does go a long way as far as really honing in on the demographic, on the pool of talent that will be a cultural fit and aligned with your values.
Awesome. Questions? Looks like we're almost out of time. Do you guys have any final closing remarks you'd like to make?
My remarks would just make sure that you put your people first. There's been a long time, I think everybody has recognized that since 2020 that the workforce has changed. And we are living in a market where, for many times, consumerism was like, you know, the customer choice, where our customer now is our employee. And you have to recognize that they have a choice as well. I worked with other healthcare organizations. They had a whole office of, dedicated the office of the the patient experience. So, you know, the idea that we need to be listening to the voice of our employees just as much as we're listening, if not more so, than the voice of the customer, because that's the market nowadays. And a lot of people who are coming into our treatment centers and working employees have somehow been impacted by behavioral health and addiction at a very personal level, and they're looking for a place to work out their passion and their purpose. So you need to listen to that group of individuals to make sure that they're empowered, they have the values, they have the purpose, and that's part of our value that we have. So we want to make sure that they're allowed to show up and live out their purpose within the organization. So, you know, my greatest tip is make sure you put your people first. That's your most important customer. They're even more important than your customer because they're ready to show up for the people who need help. That's why they're looking into this industry to begin with.
That's beautiful. And first of all, just to echo that statement and just put it in a different sentence, we sort of look at the staff as client number two. There's client number one, who's your patient, who you're servicing, and there's client number two, who is enabling you to provide that quality care. In the same way, you have to engage with marketing and admissions and create an entire infrastructure to be able to attract client number one to your facility, to your organization. You have to put that same level of thoughtfulness into client number two. They're spending the majority of their waking hours at your place of business. Why should they do that? And how do you really stimulate a sense of commitment and loyalty? Because that's ultimately what we want. We all know the financial and operational cost of turnover. It's brutal. You have to train everybody again, the talent acquisition costs, and then you don't have a consistent product because there's so much changes and there's so much shakeup that all the protocols and policies and procedures are not consistently being adhered to. So the burden of high turnover doesn't have to be, no, I don't think anybody of you need that convincing. We live in an unprecedented age where an employee very often will wake up and just the same way somebody might pop open their stock app to see how their stocks are doing, is it up or down, they'll go on Indeed and see how their stock is doing. What's their current hourly wage? Has it gone up over the last 2-3 months or not? How do you fight against that? That's reflective of a very transactional relationship with their place of employment. The third value that that's an integral part of our cultural identity is purpose. Now, think about this for a second. What's the difference between Nike and Reebok, or Apple and Microsoft, or Tesla and a Prius, or in California, Trader Joe's and Ralph's? What's the difference between all of those brands? One of them will be able to get a significant higher price than the other because they're not selling you a product. When somebody sells you a product, you start thinking, what's their markup? Or even subconsciously, you're not willing to give a higher markup than you think is fair. But when they're not selling you a product, they're selling you a feeling, they're selling you a culture, they're selling you an identity, you're not thinking, how much is this costing them? You're thinking about that feeling, and a feeling and an identity don't have a price tag. So the ultimate success of a company culture is when they feel that this job, that your organization gives them purpose, so they're not looking every month or two on Indeed what their hourly wage, whether it has gone up or down, because they truly feel like this employment gives them purpose and is their home and they want to stay.
Yeah, well said.
Excellent.
Well
Thank
said.
you, guys.
Thank you.